Well, the official countdown now is on. The holiday season kicking off this week, but you don't have to go through this special season filled with pain. Today, we have invited our expert, Dr. Christopher Miller, here, along with one of his patients, Janice. Welcome back to 8 West, Dr. Miller. Boy, the holiday season and, well, even the start of the winter weather season can really make it difficult for people who are suffering.
That's true. You know, we think about neck and back pain and just the pain itself, but these chronic conditions of the spine limit people's ability to live the life they want, do the things they want to do. And, you know, on top of that frustration, a lot of times their doctors are just, you know, continuously prescribing or recommending the same things over and over again, even though it's not really getting them better. And, you know, they don't want more pills over and over again. They want real solutions. And, you know, being a chiropractic office, we do find a lot of times patients are scared about chiropractic because they don't really know what it involves, and they're scared about the aggressive snapping and cracking of the spine. But the fact is, chiropractic here is very safe, and there's many other techniques that we use to adjust the spine that are very gentle and don't involve that cracking or snapping.
Yeah, Janice, let's talk about you. You're a retired public school teacher, which we know can be stressful on the body as well as on the intellect. But so let's talk about how you ended up coming to see Dr. Miller, because you came after having some just really failed treatment options to mask the pain.
Yes. Well, Dr. Miller and his wife were starting up their practice, and they were putting flyers in several of the Grand Rapids Public Schools mailboxes. And I saw that, and I thought, well, why not give it a try? I've pretty much tried everything else.
Yeah, let's talk about what you had tried, even as much as injections for the pain.
Yes, I've had pain injections. I had acupuncture and just various other just temporary solutions, and it just wasn't alleviating the pain.
What was going on? How much pain were you actually in?
Well, I had severe lower back pain, which like radiated into my tailbone. It made it really difficult to sit for long periods of time. And really be around family and friends and enjoy activities the way that I should. I just really didn't feel like doing much of anything, and just really felt hopeless.
Yeah, so yeah, let's talk about the chiropractic part of your business, because we often talk about the patients you're able to help through the use of the DRX 9000 and the non-surgical decompression. But let's talk about the actual, what we're seeing here is the DRX 9000.
It is. So this is one of the options we have in our office, Terry, and this is for people with severe degeneration of the spine, where the discs are nearly bone-on-bone degenerative disc disease. Sometimes those discs can be bulging or herniated or ruptured, and those patients as well many times are facing the injections or surgeries, and they don't want that. So this is a non-invasive solution that regenerates the discs and helps them feel better, because we're fixing the cause of that pain. But when we met Janice, she you know, we didn't just throw on a table and start doing decompression or start cracking her back. We did a thorough consultation and just talked for a bit about what she had been through and what her goals were, and decided to investigate further, where we did a physical exam. We took some x-rays, and upon that we found that she had some slight degeneration of her lower back, but more than that, misalignments of the vertebrae and the hips and the tailbone. And I think as we spoke, she had some concerns about manual cracking adjustments. So what I offered her was this activator adjusting technique. There's no cracking or snapping involved, and when we found those areas that were out of place, we just put that right on that part of the spine. It's just a little click and a little impulse on that rubber tip. And what that does is it helps these vertebrae or these hips go into proper alignment. It's going to restore motion and mobility and ultimately get pressure off those nerves. So again, this is helping our patients get pain relief because we're correcting the cause of the pain.
And you can also use that for the neck, which I think that's probably the scariest part of that treatment for people to think about.
Yeah, so they just lie on their stomach. We feel what's out level by level in their spine, and whatever side it's out, we just put that on the right spot in the right direction, and it's just a little click and an impulse. So it's great for people that have concerns about the cracking. We use it for infants and newborns all the way up to, you know, people that have severe osteoporosis osteoporosis and very fragile bones that are in their upper years. It's a very safe, low-force adjusting technique that works very well.
So let's talk about the relief from the pain that you were able to get, Janice.
Yes. Now I'm able to participate with my family and friends fully. I also changed my diet, which helped. Make sure I have a lot of water intake, and just exercising, which is very important.
Yeah, and it is nice too, because we know that this is something that you go for maybe several appointments at the beginning, but now you're on a maintenance. You only see Dr. Miller and his team once a month.
Yes.
Yeah, that is nice. So let's talk about how people would connect with you. You have a special that you're offering to 8 West viewers.
We're doing, it's a nice introduction to chiropractic in our office where you can see what we can offer them. But if they call our office today for $49, we'll do that consultation and sit down and meet. And if we decide to move ahead, we'll do the exam and really get to the bottom with a conclusive diagnosis as far as what's wrong as I start developing solutions for them. So it's a great special for the holiday season.
And you are also community-minded. We know you like to give back and you like to help your patients do that. You're an Angel Tree location.
We are, Terry. So this is sort of something we have going on this holiday season. You don't have to be a patient in our office to get involved, but if you do drop off a gift or gifts up to $100 with a receipt, we'll match that value in gift cards to our office for services they can use and treatments so they can start, help somebody else and help themselves at the same time.
Yeah, it is great. Well, Janice, thanks for stopping by. Glad that Dr. Miller and his team were able to help you live a pain-free life. And Dr. Miller, thanks for stopping by as we kick off the holidays.
Thank you.
And now we're going to check in with Rachel.